Morning Live is tracking COVID-19 related developments in all of the provinces. Today, our focus is on KwaZulu-Natal. The KZN Health Department yesterday announced Clairwood Hospital as the latest addition to the province's quarantine and isolation centres. MEC Nomagugu Simelane-Zulu said the province is investing in field hospitals that will be placed in several venues, including the Pietermaritzburg Royal Show grounds and the Durban Exhibition Centre. Now, the province says it is also looking into renovating its own facilities to meet the national health insurance requirements beyond COVID-19 pandemic. The province has also announced the recruitment of almost 5,000 healthcare workers in various categories who will work in the COVID-19 wards for the next 6 months and possibly longer. And we're joined now by the MEC Simelane-Zulu. Good to have you, MEC. Thanks very, very much for joining us.
Good morning, Leanne, and thank you very much for having me.
Yeah, it's an absolute pleasure. While KZN had the very first case in the country, I mean, this was, a big moment, and of course, I imagine everybody worrying at that time in KZN. It really has since been overtaken by the Western Cape, by the Eastern Cape, as well as Gauteng. Talk to us about how you managed to handle this situation.
Leanne, got our first case. The rest of the country, we were quite shocked and overwhelmed, but we couldn't stay shocked forever. We had to get into action. So, fortunately, we had already identified a couple of hospitals that we realized, that we decided that we were going to be utilized as isolation hospitals. At that point, we were not even talking COVID hospitals. We were just talking isolation beds. But after the first 2 days, 2 days after we got our first case and we got 7 cases, we realized that was never going to be enough. So immediately we got into action and started preparing our own facilities, because while it's good to have field hospitals and to have those, it's better to actually start using our own hospitals. After COVID-19, we had to make with those facilities. So we immediately work. It has taken us about 2.5 months to actually complete the majority of the hospitals, while we still have a few that are remaining. It was not an easy week. The week of the 5th, when we got our first case, everyone quickly got their heads straight, and we were able to put our heads together with the Premier and the Provincial Executive Council on what best and how to handle the situation.
Yeah, indeed. I mean, that's it is quite something to have had to deal with that at the way you did. But now, if we look at the present, the caseload in KZN seems to be lower and increasingly slower compared to the other 3 provinces. One can only ask the question, could this be due to inadequate testing or perhaps KZN missing some of the cases in some instances?
Well, I don't believe we are not testing enough, and we are testing like the rest of the province. In fact, when we started having challenges with NHLS, when NHLS is running, well, is currently not was, is currently running out of some of the reagents, immediately we got into action and we got the private sector to come in and assist in testing, and at a discussion level that is understandable between ourselves and all the private labs. So we are testing. I also don't believe we are missing people, because I don't know if you would remember, but about a month or so back, when Itegu clearly became an epicenter in the province, we also decided that we were going to be testing all over the metro of Ethekwini, and that literally meant we needed to increase our capacity in terms of the field workers and the people who are tracing on the ground. So we have literally going from door to door to pick up, to everyone and to test. And we have done exactly the same thing with Lembe a few weeks back, when we realized that their numbers were coming up. When you look at our screening numbers, we are beyond 5.5 million in terms of screening, and our testing is also coming up. So we think it's just that we don't have as the other the other provinces. I must indicate that the other thing that we do, as soon as we see a cluster of cases, we quickly get in there as a group and are able to try and shut down the fires so that they don't grow beyond where they are at that particular moment.
I mean, if we look at the trends currently and we take into consideration the numbers, initially KwaZulu-Natal had a high mortality rate. It settled down for several weeks, but now we're starting once again to see the deaths increasing. Perhaps there's an explanation for this, and also the recoveries for KZN have actually remained stable for the last few days. Talk to us about the deaths and the recoveries. What's happening?
Well, with our deaths, initially, the reason why you saw our deaths spiking, the only explanation we can give was that the virus firstly hit some of our hospitals. I think you would be aware of one hospital or two hospitals that we had to close down. And the majority of the deaths that we had then were coming from those two hospitals in particular. I mean, more than 10 were coming from one facility. So had it not been for those areas that have too many people in them who actually outside of COVID-19, we probably would have seen a slightly different picture. So those were the cluster of our deaths came from. Now we are beginning to see one or two deaths every day. It has past 6 or 8 weeks. It's quite. It's not. Well, it is a big deal. I mean, when people pass on, but it's not so different from what we've been seeing the moment that we got past the era of the hospital that gave us a lot of deaths. Sorry, what is the second question?
We were talking to
the recoveries.
That's it, the recoveries.
Yes. No, when you look at our recoveries right now, we've got about 48% of the recoveries, which I think is just about to be in line with additional 1,219 cases and 1,572 recovered cases. So when you look at those, they are in line with is doing because about half of the recovered cases.
Oh, this line is terrible. We keep on losing you through some of the answers, but I'm hoping we'll be okay now. Because there's so many questions we need to get to you.
Yes.
One of the most serious hotspot by district is Ilembe, according to national data. This, of course, I mean, between eThekwini and Ilembe, these are the two districts that are contributing more than 80% of the total number. What's happening there? Why?
Well, what we found in those areas, firstly, the infections from Ilembe actually emanated from the work areas, from your factories, from your supermarkets and so forth. Now, when people got infected there, they then transported the virus back home where they're staying, and the interactions between the community started to get the virus to spiral out of control. But what we have done immediately when we realized that there was a challenge there, we just went in and swooped in, and were able to isolate those that needed to be quarantined, take those that needed to be isolated and put them in the facilities that are necessary to do so. As a result, when you look at the numbers in the past 2 or 3 days, past 2 or 4 days, you will realize that the numbers of new cases are decreasing compared to what we have been seeing in the past 14 days or so.
I want to talk about, I received quite a disturbing email, and it's quite a coincidence that we happen to be speaking to you, so I can ask this directly to you. It's from one of our viewers. I'm not going to mention names because I'm not sure if she'll be comfortable with this, but we obviously had an interview in the first hour on the program talking to the Cuban doctors that had been sent to South Africa to assist and to help where they are needed, and that is, something that we all know about. However, this email that's come through has said, we need to investigate the Cuban story. My son, who is a doctor, works in a rural area in KwaZulu-Natal. His contract cannot be renewed as out of budget, his hospital has to pay for the 2 Cuban doctors now.
No.
It's a 40-bed hospital allocated and now to asymptomatic COVID patients. So he's out of a job, as well as 158 more people. It's madness. Help me here, MEC, what's going on?
It's not true, Leanne. It's not true at all. We do not have unemployed doctors in the province of KwaZulu-Natal. In fact, we have just written to the minister to request him to give us more money because we are looking at recruiting doctors from the private sectors, your GPs, your specialists, and so forth, because we want to add on the capacity that we have, not because we have vacancies, but because we have created new beds in our own hospitals, but we are creating new beds in the field hospitals. So obviously we are going to need more clinicians. So there is no way you are going to have doctors that you can't employ from your own budget when we are actually asking ministers to assist. So it's not true that we have doctors that are out of a job. In fact, the budget for the Cuban doctors does not come from facilities. The budget from Cuban doctors come from National Treasury and was sent directly to the provincial to the provincial department, which means it comes from our own boat as a provincial department, not from facilities.
Yeah. So this comes from the KZN budget. How many Cuban doctors do you have working in KZN?
We received 27 health specialists, and of those, 3 are epidemiologists, and then we have 4 health technicians, and the rest are family physicians.
Okay. And the total cost to you? What is it costing the KZN Health Department?
Well, right now, the costing of the Cuban program is with National Office, because they are the ones who actually engaged with Cuba. They're the ones who engaged with the National Treasury on how it's going to be sorted out, and then they will then forward us whatever budget. However, we are still currently working on how much it's going to cost us eventually once we have received the budget and everything that goes with it.
But MEC, can I get your assurance that you'll look into this? Because, you know, it's very hard for me, and I am just relaying something that I saw that has been sent to me directly. So can you look into this? Because to hear stories of doctors actually losing, I mean, it's very hard for you to obviously follow every single clinic and rural hospital in the entire province and know what's going on directly. Can you look into this? Because if it is in fact the truth, it has to be unacceptable.
I can look into it, Leanne, but you know what upsets about that particular email is that it's perpetuating a narrative that is incorrect and that is not there.
All right.
You know, the comment I can look into it, but I can assure you sitting here that there is absolutely no doctor that's going to lose his or her post based on the fact that Cuban doctors, by the way, a doctor that is employed by a Department of Health signs a contract. So why would, when a Cuban doctor come into a facility, then your contract suddenly be terminated? So it's even legally, it just does not make sense. But you can send me details of the hospital, I will check, but I can assure you it's not true.
Excellent. MEC, thanks for responding to that. Let's move back to the issue of investing in field hospitals that will be placed in several venues, including the Pietermaritzburg Royal Show grounds, as well as the Durban Exhibition Centre. How's that all going?
Sure. What we decided to do, and we divided our hospitals or our beds into 3 categories. The first category is the beds that are in our own facilities, own hospitals, the ones that we've already spoken to. Then we create field hospitals from community structures that are already there. And then thirdly, we create what we term temporary structures. So Royal Showgrounds and Durban Exhibition Centre are the field hospitals where we are creating hospitals from structures, community structures that are already existing. I must indicate, Leanne, that I'm extremely excited that Royal Showgrounds is completed already, and maybe next week the Premier is going to be officially handing it over to the district Department of Health for them to start utilizing it. But out of that facility, we are going to be getting 290 isolation beds, and that's extremely That's a big capacity that we have created. With the Durban Exhibition Centre, the National is assisting us there. They are creating that particular field hospital, but out of that, we are going to be getting 450 beds, and that's a lot as well. Right. Then with the temporary structure, we decided that we are going to put up 4 at the beginning of the pandemic, and that's what we are working on. And as soon as we need more beds, we will start creating the temporary structures incrementally. So when we put up 4, every structure has 113 beds in it. So it gives us quite a big capacity. For now, 2 of those temporary structures are going to go to eThekwini Metro. One will go to Ilembe, as we were talking about it now, and the fact that the numbers are going up. And the third one will go to King Cetshwayo district. And then we start looking at the other districts that have a challenge. For instance, Herikwala district has less hospital beds than the other areas. We are going to start looking at those.
Finally, MEC, you are making arrangements as well for additional quarantine centres and beds, but as the death toll of COVID-19 is expected to rise over the next couple of months, because that's what we have been told, eThekwini municipality says there's a dire shortage of burial space, a very sensitive topic and one that none of us really want to engage in, but it's vital that we do, due to religious reasons and for cultural reasons. What's the situation? How is the provincial team looking into this?
Well, fortunately, just yesterday we had a meeting as a executive council with COGTA and the municipalities of eThekwini and Ilembe, and they were giving us a breakdown of the sites that they have and the crematorium areas that they have. We agreed that they are not enough. They have been given a task to go back and relook, and on Tuesday, this coming Tuesday, come up with a new plan on where they are going to create these areas actually should the needs arise. But we are correct. It is a matter that is quite worrying, and is a matter that the provincial government has taken seriously.
All right. Thank you. Thanks very, very much.
Thank you very much.
Thank you, MEC. We really do appreciate your time. KwaZulu-Natal Health MEC Nomagugu Simelane-Zulu giving us an update on the state of the province with regards to the COVID-19 pandemic. Here at Morning Live, we're trying to speak to all of the MECs around the country for the respective provinces. The time now is 8:30. Let's get the news headlines. Sakina, what's happening?